Hey everyone, this lesson is on the new coronavirus from Wuhan, China, otherwise known as 2019 nCoV. In this lesson, we're talking about the incubation period for this virus, signs and symptoms, some risk factors. We'll also talk about how we can make the diagnosis of this virus, and we talk about possible treatments and preventative measures. So the 2019 nCoV stands for 2019 novel coronavirus, and this is the virus that was recently discovered in Wuhan, China. It is a beta coronavirus. It's actually the 7th coronavirus found to cause illness in humans. And like other coronaviruses, it can cause respiratory and gastrointestinal infections due to its ability to bind to respiratory and gastrointestinal cells with its viral proteins. And it can lead to a variable clinical picture. It can have variable respiratory and possible gastrointestinal symptoms we talk about in this lesson. So when a patient gets in contact with this virus, there is an incubation period. It takes what we believe to be anywhere from 2 to 14 days following exposure. So after getting exposed to the virus, it takes approximately 2 to 14 days to experience symptoms and become ill with it. And as I mentioned before, it can have a variable clinical presentation. So in some instances, patients can have this virus and be asymptomatic. They can have no symptoms. They can have maybe some mild symptoms, and it can even go up to severe illness and even mortality. And what seems to be the case from what we see in our evidence now is that older individuals, adults greater than 40 to 50 years of age, being male and having pre-existing comorbidities, can be risk factors for contracting this virus and having worse clinical presentation, so more severe illness. So what are some of the common symptoms of having this virus? So there is some evidence that has been shown in the Lancet and other journals that some of the common symptoms include fever. So fever is actually the most common finding we see. So individuals with this virus seem to almost always have fever if they present symptomatically. The next one is cough, and the cough can either be non-productive or productive, which means that there can be sputum or it can be a dry cough. This is the second most common symptom, and it's more often to be a dry cough or non-productive cough than to be a productive cough. So if we see symptoms, those are the two most common symptoms. Another common symptom is shortness of breath. So shortness of breath can be a common symptom as well. Difficulty breathing is another common symptom. We can also see malaise and fatigue. So being very tired, having very little energy can be common symptoms as well. What are some other symptoms, less common symptoms? These include myalgias, so achy muscles. We can also see headaches. These are more rare. We may also see confusion, sore throat, and rhinorrhea or a runny nose. And again, these seem to be less common symptoms. We can also see gastrointestinal symptoms. We mentioned before that coronaviruses can cause gastrointestinal infections, and we can actually see diarrhea and possibly nausea and vomiting with the coronavirus. This is, again, extremely rare. This seems to be 1% or less patients having this. So right now, it seems that the common symptoms I talked about in the previous slide occur in the majority of cases: fever, cough, shortness of breath. So these other symptoms, again, are very rare, especially the gastrointestinal symptoms. And it seems that approximately 20% of individuals who contract this virus have a critical presentation. They become very ill. This can include a very bad pneumonia, renal failure, so kidney failure, acute respiratory distress syndrome or ARDS, and death. And this can occur infrequently, but it can occur in approximately 2 to 3% of cases, and it's normally due to a multiple organ failure. So again, these more critical illnesses and having more symptoms in general seem to occur in older individuals who are particularly male for some reason and who have underlying comorbidities. So those are the risk factors for having a worse presentation. So we're now going to talk about laboratory and imaging findings. So some of the laboratory findings in individuals with this virus include the following: neutrophilia, so increased neutrophil counts; lymphopenia, so decreased lymphocyte counts; thrombocytopenia; transaminitis. So transaminitis is essentially having increased ALT and AST levels. Those are enzymes in the liver. So this seems to cause a little bit of liver injury as well, and increased LDH. Now, with regards to imaging findings, this is a very important one to note. So if we were to take a chest x-ray of an individual who does happen to have this virus and has pneumonia, it seems to majority of the time be bilateral, and this is very uncommon. So it's a bilateral pulmonary infiltrates that are seen on chest x-ray. This